Good afternoon, everyone. Dr. Jacqueline King here, the CEO and founder of Black Women Empowered. And I am back with our friend, Dr. David Ajibade. And we're going to be talking about breast cancer and breast cancer awareness on this um, October, where it is Breast Cancer Awareness Month. So, Dr. Ajibade, how are you?
I'm doing good. Dr. King, how are you?
I am doing well also. So let's get right into it. So, what are the statistics? We know that Black women have a higher rate of breast cancer. Start off talking about that.
Yes. So across the board, Black women, well, not just compared to whites, but compared to all the races, tend to have it has a higher rate. Not only that, but more importantly, the death. The below the age of 50, 44%, that's the number they use to be you're more likely to die from breast cancer. But after the age of 50, it becomes a lot worse. You're twice as likely, that's like 100%, to die from
After the
breast
age of
cancer.
50?
Yep, after the age of 50. And yeah, this is very sobering statistics. And I mean, there are different reasons they attribute for that. Everything from racism to the genes to lifestyle. Um, and obviously, I always like to look at the things that we can control, the things that the individual can control. Obviously, you can't control the environment. Uh, you can't as much control racism, but you certainly can control your lifestyle. Certainly can control your diet and a few other things. Hopefully, we can talk into that some more. But yeah.
Yeah, so tell me. Uh-oh. I got an echo. What you got going over there? Is that you? Or is that me?
Uh, I didn't change anything. Has the echo been on since?
No. Okay, let me just make sure. So you say after 50, they have a higher rate. Why is that? We have a higher rate.
Well, I would probably attribute that. They didn't say why. I was listening to an oncologist talking about it. She didn't say why, but everything becomes worse when you cross. Well, usually when you cross 40, but the older you get, the weaker things are. Everything from your immune system, and it's you look at the damage that has been done over the years. So after the age of 30 is when you kind of reach the peak of your powers, your natural powers, so to speak. Your immune system, your brain is fully formed, your muscles are fully formed and fully developed. So you plateau at 30. Usually you don't get any stronger naturally from there. So things begin to kind of go south. So your immune system strength either plateaus or begins to weaken. Same thing with your eyesight, same thing with your muscle mass, same thing with your bone strength, and so on and so forth. So by the time you get to 40, you've had about 10 years of quote unquote deterioration. By the time you get to 50, you've had 20 years, 60, you've had 30 years. So I think I would attribute it to just the general weakness and making it um, less in, or the decline to be greater. And I think about it this way too, and we'll probably get into this as well. Things like vitamin D and other nutrients that our bodies need to fight off cancer, we Black people tend to be deficient more in some of these things. And again, you think about 10 years, 20 years, the longer you're deficient in something, the worse, the more likely you're going to be subject to that thing, to whatever it is that thing was protecting you from. So that would be my surmising that that's probably part of why it's worse when you get older.
Let me ask you, Doc, is it true that um, a lot of younger women are now getting breast cancer? And are they
Very.
and they're I don't know if they've already changed um the age for mammogram, but they were talking about pushing it back. Is this accurate?
Yes, indeed, for black women, and not just for breast cancer, but also looking at for colon cancer as well, as opposed to white people. I believe it was 50 years before. Now they're saying probably early as 35 years of age to get the mammogram. So yeah, they tend to, because we're seeing that Black women tend to have it at an earlier age. The breast cancer now tends to be more aggressive, and it tends to be more resistant to treatment than to white people. And you got to remember, Dr. King, most of the research, most of the drugs are when tested on Black women, they were tested on white women and white people. So we are just by extension, they were pretty much assuming that because it works on white people, it's going to work on Black people. And so and many times that assumption doesn't always hold true. And so that's probably one of the reasons why it's so difficult. There's a greater risk of relapse, greater risk of resistance of the cancer to the treatment than amongst white people compared to Black people. So
are they now starting to do more tests on Black people, or it's just, it is what it is?
It's a challenge. I mean, and that's across the board, whether it's in cancer or in dementia or in heart disease. Part of the hurdles include the fact that Black people have to find their way to the hospitals. Sometimes, again, that's part of the issue in the environment where even though there are incentives to be a part of the research, there might not be accessibility as much. Maybe the hospitals and research centers are too far away from home to make those trips every day, or they might be, now they talk about this a lot, with the suspicion of Black people towards anything Western medicine, so to speak, because of all the atrocities, so to speak, that were committed in the past. Obviously, you know about the I've forgotten what was the states now. It wasn't Mississippi or somewhere where they were testing syphilis on Black men, and it was very, very immoral. And so there's been a lot of abuse of trust over the past, and that still sits a lot with the Black community. But that's one of the challenges. I do a lot with dementia and memory loss, like you know, and I think I shared that link with you. The Black lady, she's trying to encourage more and more Black women to go do screenings and be a part of the research for dementia, because Black women have it worst where dementia is concerned. And she's like, one of the challenges is that our people don't really trust the system as much, and so they don't turn up, they don't volunteer to be a part of the research, the research project. So that's a challenge, unfortunately.
Oh wow. So do you recommend, I know there are people that only will go to Black doctors because they feel like Black doctors understand them if they're Black. Is that something that you believe or recommend, or what?
I would really be hesitant to do that. I would really be hesitant. I mean, it goes both ways too. White people will go to white doctors. It doesn't always hold true that Black doctors would totally understand what you're doing. I mean, I remember I was with my friend in Tulsa, Oklahoma. He's a doctor himself. He moved down from Wisconsin, and he wanted to have his annual checkup, and so he definitely goes after a Black doctor, and they do the whole checkup and everything that needs to be done. And at the end of the day, I mean, he gets a decent bill of health. So I asked him, I said, well, did they test your vitamin D levels? And he said, no. And I'm like, what? Of all the things that you did, if you're dealing with a Black patient, you've got to test the vitamin D levels, because we are notoriously low. Over 80% of us, I think that's being very conservative. We're notoriously low in vitamin D levels. And vitamin D, we're finding out, it affects so many things, including your risk of cancer, your risk of breast cancer, heart disease, prostate cancer, colon cancer, asthma, lung problems, and the list goes on and on and on and on. So if you didn't test and that was a Black doctor. You would expect Black doctors to know about this, but clearly he didn't know. So I wouldn't put too much stock. I think you just look for someone who is competent, and don't. You're not looking for a friend or another brother. You're looking for someone who is able to treat you properly. And that's what I think we should look for. And I understand too that the challenge is that sometimes in these institutions, these big hospitals, white people may not. I'm not going to be throw a brush of everything. But sometimes white doctors, there have been accusations that they don't treat them as well, treat black patients as well as white people do, as well as treat white people. That's a problem. So, I mean, what do you do about that?
So do you recommend, and it sounds like if the doctor isn't asking you to check your vitamin D, you should be saying, can you check? Do you recommend that?
Absolutely. And that's why we're doing what we're doing. That's why you're doing what you're doing. It's all about empowerment. It's all about letting people know how to engage with their healthcare providers. You cannot just be passive. You cannot just say, well, if my doctor doesn't tell me to do this, I'm not going to do it. Because unfortunately, in the last 2 years, there's been a large number of reasons to distrust doctors, whatever their race may be, unfortunately. And again, it's not all their fault. They don't know everything. They just go by what the book tells them to do and what the authorities tell them to do. It may be right. Many times it is, but sometimes it could be wrong. And you're stuck with the one body you have. So don't leave all your power to some other person when you know you're going to have to live with this body for the rest of your life. So that's my 2 cents. You've got to ask the questions.
All right. So now that we're on the questions, what are some of the questions we should be asking as Black people?
We're talking about breast cancer or
no,
in general?
We're still on breast cancer, but since we're on the questions, I want to get that out there. When you go get your annual physical, what are some of the questions you should be asking?
Good. That's great question. So obviously you want to make sure your vitamin D levels, right? You want to ensure that your vitamin D levels are okay. Now, not all hospitals do this, but there are medical centers or labs outside. You want to check your insulin levels, your insulin resistance, because we're finding out that
A1C, right?
No, that's sugar. That's your blood sugar levels.
Okay, so insulin levels is completely something else.
It's related to diabetes, but it is broader than that. So insulin levels is basically the ability of your blood cells to take in sugar, to respond to insulin. Without insulin, your body doesn't take in your blood cells don't take in sugar. Insulin is like the key that opens your blood cells to take in sugar. If your body's cells, if your cells are not responding to insulin, what happens is that insulin begins to rise in the blood, in the body. Okay? When it's different from sugar, I know this sounds a little confusing. Maybe in another video we can talk about it. But again, for sugar to get out of the blood into your cells, the insulin has to open the door or turn the key to let the sugar get into your cells. If insulin does not open that key, the sugar will not get into the cells. Therefore, sugar will rise, and that's what you check in the A1C. But also the insulin levels also rise, and these are 2 different problems. The sugar is one problem. Insulin levels is another problem as well. And the high levels of insulin can cause a lot more damage than even just the sugar itself. Unfortunately, they don't test for the insulin levels. They only test for the sugar levels. And we're now seeing that high insulin levels can lead to dementia, it can lead to cancers, they can lead to heart disease and strokes and these other things that the people may actually have normal sugar levels. So you see what I'm saying? You can have normal sugar levels, but you can have high insulin levels. And that's a problem. Nobody looks at that. Very few people look at that. So that might be a test you want to do. Another thing you want to do is you want to make sure that your vitamin B12 levels, we're low in vitamin B12 levels as Black people, and low vitamin B12 levels can lead a known risk factor for breast cancer specifically. So you want to make sure vitamin D and B levels are okay. There's another test for inflammation. And it's called C-reactive protein, CRP. And then if you want to be really super cool about it, you can test for high sensitivity, HS, small h, small s, capital CRP, high sensitivity C-reactive protein. This is a test for the level of inflammation. Again, inflammation levels, and that's one of the key things. We've been talking about this for over 20 years now. High inflammation levels in the body can predispose you to a lot of things, including strokes, heart attacks, and of course, cancer. So those are the 4 things that I would strongly recommend. There are other things as well, but these are I think these stand out the most to me. Vitamin D, insulin sensitivity, C-reactive protein, that's for inflammation. And then the 4th one is vitamin B12 levels.
Okay, are all these covered under major insurances?
Yes. If you go to they would have to check these things, but many of them are, yes. You just have to get to the right center. Hospitals, probably not. Like I said, you want to look for labs outside.
But what I'm saying is, if you go to your regular doctor and you're asking them, I want all this done, if you have a major insurance plan, they should be able to bill them, right?
Lonnie Woods.
I was told yes, for a major insurance, but again, don't quote me. That's you still have to check.
Okay. All right, let's get back on track. That was you always get me off track because you say something that I want to hear more about. But let's get back to what we are here for. But that's good information. That is great information. And I want you to send me those in a text so I can add that to this broadcast so that the people will know what they should be asking for. And I'm gonna do the same thing because I didn't know. But one more thing about the insulin levels. So what test did it is all these blood tests or something else?
It's called insulin sensitivity test.
But how did they test?
Yeah. Right. I'm sorry. It's all blood test. Yeah, I just had mine tested a few months ago. Yeah, they took a lot of blood.
Okay. All right. Okay. That's all I wanted to know. All right. So let's get back to breast cancer and Black women. So we already know that we're higher risk. What are some of the things that we can do as young women, middle-aged and older women? I hate to say old because we don't get old, we just get better.
That's right.
I did not pay him to say that, guys.
I'll be expecting the check in the mail, Dr. King. All right, so all right, so what can be done? So I like to look at the do's and the don'ts, but you want to base that on the risk factors. So among the things that they see are the risk factors as to why Black women have it worse. Obviously, we mentioned diet. I'm going to get to genes in a minute, but let's talk about lifestyle a little bit, and then environment too. But lifestyle, some of the things, obviously, being overweight and obese, the numbers say that you're 4 times more likely to have a 4 times higher risk if you're obese, as in really overweight. Doesn't mean you should be skinny either. So that's a different thing. I know they say black men don't like skinny women either. So you want to have that Goldilocks.
You have to go there.
And then of course you want they say denser breasts, that Black women tend to have denser breasts. There's not much you can do about that than white people.
What does that mean? What does that mean, denser breasts? Explain that.
So the tissue, the fatty tissue in the breast is thicker. They have more cells, they have more ducts, those ducts that milk flows through, they seem to have more of it. So if you take an inch of a person's breast out, if you compare the Black person's bone to the white person's bone, that person has more cells, have more ducts, have more channels, have more tissue. If you were to count them one by one, they would have more of those than the white person does. So that takes us to the next point, and I'm jumping around a little bit. So that's why it's so important that you get familiar with your breasts, and especially after the age of 40, but probably earlier, you want to start on a monthly basis on your birthday. So I'm December 12th. So October 12th, November 12th. If I were a woman, I'll be getting familiar with my breasts, feeling through, just getting familiar with what the consistency looks like, and then testing each month just to make sure it could be any kind of change. They could be getting smaller. Breast cancer could be anything. The skin around the breast could be changing. The nipple could be changing. It could be pointing in a different direction than it was before. I'm not trying to be facetious here. And you'll only also check your armpits as well, because there are nodes there that can be indicative there's something going on in the breasts on each side. There are some nodes or lumps, quote unquote. You can't feel them normally, but if there's a problem, if there's an inflammation, or if there's cancer, you could then begin to feel them. So you feel your armpits. You go through the process, and I'm sure on the web, on the internet, there are different ways, and on YouTube too, they can show you how to test your breasts. But it's really, really important. You shouldn't take it lightly. Once you're shaving in the bathroom, whatever you're doing, just make sure you remember on your birthday of each month, do your test for your breasts. So we talked about density. We also want to talk about the activity levels. So you in general, yes, Lululemon or white people tend to be more active. They tend to go out for yoga, and they tend to run out more than Black people do. You really want to step up on your physical activity. That's a common denominator. If you're going to improve your health, you've got to improve your level of activity. I know we've said it several times. We've heard it several times, but it just needs to be done. It's getting cold now. You've got to figure out a way to improve your activities. Another thing that they're looking at.
Wait a minute. Let's stay there for a minute. So even if you start small and doing like 10 minutes a day, it's okay, right? And then you kind of work your way up.
Absolutely.
Because a lot of people think they got to go out and run through 5 miles like on the first time, and then when your body is like completely exhausted and aching and all that, then you don't want to do it anymore, right?
Right. So you want to start. You're right, Dr. King. Consistency is the key. So you want to do it. If you had a buddy to do it with, that would be very helpful as well. If you have a pet, that will force you to get out. A dog, probably not a cat, but a dog would force you to go out more. But consistency really, really helps. I got a place in Baltimore because this was where I could find a squash court. Most places don't have squash courts; they have racquetball courts, which is an American thing. I was raised British in a British colony, so a squash court. So that forces me to play. And then so one of my buddies, he sends me a text this morning, says we should play tomorrow morning at 6:00. Well, I hate that. I hate to wake up at 6:00. Well, I have to wake up at 5:00 to get there on time. But that forces me to play and exercise. Otherwise, I wouldn't do it. So find someone you can do it with, and that will take you so much further, I think.
One of the things that I used to work in assisted living, I was in the office, and I saw one of the things that activities that they used for the elderly was the Wii bowling. And that's still activity, but they would get them moving. So if you have something like that, that would work too, right? It's still moving, right?
Yeah, absolutely. Whatever you can to increase your activity levels is always a good thing. It's very hard to find something negative about movement.
Okay, so what's next for prevention? Is there anything else that you should be sharing, that prevention or some things that they can do? I know eating. Let's talk about eating the right types of foods.
Right. So before we get to eating, there's something I have to point out too, and that's what you put on your hair and what you put on your body.
Oh.
I gotta be careful here, I guess. But so they look at hair care products, and they're seeing that Black women tend to put a lot more hair care products on, and more than white people do. And they try testing the hair care products. They have certain chemicals called parabens, phthalates, and fragrances. And they're seeing that they tested them and compared, and they're like, it seems as if there's more, like I said, that they're being put on Black people's hair obviously, if you work in a hair salon, you're inhaling a lot of hair, a lot of these toxins, because that's a lot of this about toxins, and they tend to react. They see that in black, when they compare black women's cells to white women's cells, black women tend to react a lot more, have a greater risk of converting to cancer than white people's are, based on the hair products that they're exposed to. So that may be as a result of the higher concentration they're exposed to, or it may just be another thing with our genes that make you more susceptible to these things. So that's very important that you want to do it. Now, if you're concerned, if you live or if you work where in a hair salon and you're constantly exposed to these things, I would strongly recommend, and I think I've talked about this before, there are certain nutraceuticals or supplements that can trap, and they're not toxic at all. They're like supplements. I take one myself every night. It attracts the chemicals, the heavy metals, and everything else that we just talked about, and it helps you pee them out naturally. So if you're concerned about toxins, I would strongly recommend that. Other things that they've seen that can be helpful are things like vitamin C. I will probably get into supplements later. Vitamin C, to some degree can help with, if your body is full of toxins, you can help in that regard. But I like to use what I call the zeolites, which is what I described earlier on.
Yeah.
So,
the hair chemicals. Now I know a dermatologist that used to be with us, and especially for the relaxers, are really, really bad. They're finding out they were bad before, but they were finding that they actually hurt the reproductive system if you start using them on girls before 12. They ended up with fibroids, which we know we're high risk for those too.
Yeah.
And then it also infertility. And yeah. I'm not a doctor, but I would think that even if you're older, those chemicals, what that takes to straighten your hair out, that's got to be pretty strong, and you got to leave it on there for 30 minutes. It can't be healthy, right?
Yeah. It's good for people to be aware of these things. And then before we leave this, all your deodorant and the spray, I mean, those two contain aluminum and lead, aluminum especially for the deodorants. That's a challenge itself too.
But so everybody uses that. So does it affect white people the same? Do they use deodorant? Or it affects them worse? What?
That's true. Everybody uses that. So and it's just for people to be aware of it as well. So if you can use so if you can just know this, you compare yourself with a white person. Usually, when it comes to many of these things, you get a disadvantage. so I mean, sorry to say that, but that's the other disadvantage. So you just want to be super extra careful. If there are no deodorants that don't have the aluminum and some of these toxic chemicals, they are more natural deodorants. If you can have access to them, it's probably a good idea to look for them.
Doc, what about cleaning products? Does that has it been connected with any type of cancers or breast cancer or?
I don't know about breast cancer specifically, but cleaning products in general. In fact, some people say that the inside of your home may even be more toxic than the outside of the home. So you want to, everything, those harsh chemicals from Clorox, chloride, and fluoride, and lead. I mean, there's a lot of those things. In this our modern life, the focus is on efficiency and effectiveness, and less on health and safety. So there's a lot. And like you said, we were talking about young kids, even in babies now, pregnant women, they're beginning to see a lot of toxins in the cord blood of the babies. So we're surrounded by these things. That's why it's so important that you do the things that you need to do to either avoid them or at least to empower your body or strengthen your body so that your body can neutralize and remove them as quickly as possible. And there are ways that can be done as well.
I went to natural hair 8 years ago. It was the best thing I ever did in my whole life.
Oh, wow. Why do you say that?
Well, because the first of all, when you're going through menopause, your hormones change. You know that's naturally going to happen. My hair started falling out. I always had nice, thick, long hair, and it just started falling out.
Mhm.
But just the fact that that chemical, when to get it straight, typically you got to wait till you feel that burn. I know you seen, is it burning yet? I don't know. Maybe you did. Maybe they didn't do that in Nigeria. I don't know. But that's really, it's got to burn for it to get good and straight the way you want it. Most people want it to be. But the reality is now they've got so many ways to, if you want that straight look, you don't have to use chemical. You can do, they've got great flat irons and all kind of stuff that you can use to keep from, I don't know how we got way, but we
Well, I mean,
always,
I would say with the younger kids, teenagers, try to avoid giving them a palm, exposing them to these chemicals, because many of these things, when you talk about cancer, sometimes it takes decades to actually build. So you just don't want to give cancer a head start. You want to give them be natural as much as possible. I know they'll get a lot of pressure from their peers and all that, but it's probably best to just avoid these, especially for the really younger kids.
okay. So, where are we with so have we covered all the things that they can be doing to kind of, I mean, if you can't, there's no guarantees, but preventative things that we can do. Have we covered everything?
Oh yeah. So another thing I just wanted us to point out, I really have to point this out, is about your teeth, your dental health as well. You got to be brushing your teeth at least twice a day. You want to be flossing as regularly as you possibly can, especially at night. You want to be brushing your teeth at night. Some doctors say it's better you brush, if you're going to brush your teeth once a day. It's best you brush it at night, because that way you remove all the junk that you've been exposing your mouth to through during the day. You got to brush it. It's best you brush it twice a day. Um, they're finding out that a lot of gum disease and tooth decay, and of course, mercury fillings are related to guess what? Things like heart disease, breast cancer, and dementia. More importantly, there's some specific kinds of gum disease, like infections, that track specifically into the breasts. There's a specific kind of bacteria that they found out through
What?
research. There's a specific kind of bacteria, yes, that tracks to the breast and puts you at a, if you have this gum disease and that bacteria is there, it can put you at a much higher risk of developing breast cancer eventually. So the key thing here is to ensure that you've got good dental hygiene. You brush your teeth, floss them out, and if you have the good dental insurance where they give you twice a year teeth cleaning, that'll be a good thing too, where they can actually look at your teeth and test to see if there's anything going on, because they may not catch it all, but at least the mere fact that you're staying on top of this and making sure that you're checking these things and not leaving it for granted may also help a great deal. So many people, dentists and even cardiologists and cancer doctors, don't talk about this, but dental hygiene could be or dental non-hygiene could be a really strong risk factor for breast cancer as well. And
And I noticed that because I noticed that when I go to the eye doctor, they've got much more comprehensive now, and they can see a lot more when they look in your eyes through those machines. Is that correct?
oh yeah. I don't know if it helps. I don't know the connection with that with breast cancer though, but yes, it's technology is improving across the board, thankfully.
Okay. So, where do we fall at as far as, I don't know, maybe you don't know this answer, dental hygiene as the African American? Where are we on that scale?
Well, I do know we've got great teeth compared to white people.
I can't, I can't with you.
Yeah. You disagree?
I don't know. You mean great looking teeth?
Oh yeah, I mean,
Is
great,
that what you
healthy.
mean?
I think we've got great looking teeth and more endure. I mean, we don't have as much tooth decay in my experience, than than the white people do. Same thing with osteoporosis and bone problems.
Now why? Okay, and I hate to get off the topic, but why is it that okay? So some things affect us more, but I do see more of them with osteoporosis. Is that because that's not because of a lack of vitamin D?
No, that's and that's an interesting factor. That's the one outlier that I've seen. That even though we have low levels of vitamin D, we don't have as much osteoporosis. I mean, our bones tend to be denser and thicker, which may be one reason why and our muscles too, which may be one reason why we don't have too many black swimmers as opposed to white swimmers. We tend to. I mean, I couldn't float to save my life. I can swim, but to stay in one place and just float. I mean, I don't know how they do this the water polo and all this gymnastics they do in the pool. I've never seen one black woman in doing all those gymnastic things in the pool. That I have not seen one. Have you?
No.
I mean, they're beginning to get more active in the swimming. Anyway, so I can't explain that. Nobody's been. I've tried. I've looked for it, and nobody's been able to explain why we have thicker, denser bones and we don't have as much osteoporosis as white people do, even though we have lower levels of vitamin D. So I couldn't explain that to save my life, quite frankly.
Well, as we wrap up, I know that there are some vitamins that you personally represent that can help. If anyone wants to purchase them, give them your website so they can go and take a look at it. You have some things that will help with their overall health. Would you share that?
Sure. So our website is brainandbodyfoundation.org. brainandbodyfoundation.org. It's primarily a website focused on helping kids with brain disorders, but on the side we also promote other things like I'm talking about the toxin, things that help to remove toxins, things that help to boost your immune system, things that help to improve your memory and help you in your fight against cancer. We do not do anything that is against what the doctors. We're not antagonistic to standard medical treatment. What we do is we focus on improving your body's health, strengthening your body, empowering your body, so your body will be able to fight disease and work better with that. We find out works better with the medications and treatments. So brainandbodyfoundation.org. My email address is david.wordquest@gmail.com, david.wordquest@gmail.com, and then hopefully we can answer your questions if you have any.
Yeah, and if you want to get Dr. Ajibade as a keynote speaker for a fee, go ahead and email him. You might want him to speak to your church or your organization. He's open for that. Is that correct, Dr. Ajibade?
Sure am. Thank you.
And give that email one more time.
David.word, WORD, quest, QUEST, @gmail.com.
Okay, so thank you again. Is there any closing remarks that you would like to share before we end? And like I said, if you have any questions on this show or anything else that we covered today, you feel free to email Dr. Ajibade. Do you have any closing remarks, Doc?
Vitamin D3. Please take your vitamin D3. We all need it, especially we're getting to the winter now. You can't be without it.
And what's the milligram that you recommend?
So 10,000 international units is what I recommend. Now they recommend 600 to 800 international units. That's the standard recommendation, but people who know and doctors and researchers who know are saying that that's ridiculous, especially for Black people. So 10,000 is what they say. I use much more than that. I use like 20 to 25,000, but I can't defend that for somebody else. But if I'm recommending for other people, I'll say you got to take 10,000.
Okay. Thank you, Doc. We thank everybody for tuning in. Please share the broadcast. We endeavor to bring people on that will help you in your life walk, living professionally, personally, and spiritually. So I hope that you have enjoyed this broadcast. And thank you again. Share the broadcast. And Doc, thank you so much.
Thank you for having me.